Hello, my name is Josie and I'm going to be talking to you today about the active first stage of labour. There are three different stages in labour. The first stage starts with the onset of regular contractions along with the dilation or opening of the cervix and ends when the cervix is fully open, said to be 10 centimetres. The second stage, often known as the pushing stage, starts from when the cervix is at 10 centimetres and ends when the baby is born. The third stage is from the birth of the baby to when the placenta is delivered. The first stage can be broken down into the latent phase and the active phase. The latent phase is the early part of your labour and can consist of irregular contractions that can be uncomfortable or painful. This will not be constant. It can come and go in a cluster of contractions that might then settle for a long period of time, and you will be able to rest and recoup in between. It can feel like you are experiencing period-type pain or backache to start with and throughout. This time, the cervix or the neck of the womb is becoming softer and thinner. This can take a few days, particularly for first-time mothers, until the contractions slowly start to build up, becoming more regular and more painful as the cervix begins to stretch and open up to 4 centimetres. For women who have had a baby before, this phase can be much quicker, lasting around 6 hours or even shorter. The latent phase is followed by the active phase of the first stage of labour, which is more intense and is normally shorter than the latent phase. You will hear staff refer to established labour, and this is what they mean. The active first stage of labour is when the cervix opens from 4 centimetres to 10 centimetres to allow for the baby to pass through. If this is your first baby, the active first stage of labour will last on average 8 to 10 hours, with a maximum of usually less than 18 hours, and will be shorter if you've given birth before, at around 5 hours, with a maximum of usually less than 12 hours. During this active phase of labour, contractions become more powerful, stronger, more regular and longer lasting. They normally last around 60 seconds each, with at least 2 contractions in a 10-minute period, and there should be time to rest between the contractions. The muscles of the womb contract, but they do not relax completely after each contraction. This results in the cervix being pulled upwards, which makes it dilate. At the same time, the contractions slowly push the baby further down the pelvis, and the pressure of baby's head against the cervix encourages your body to release more oxytocin hormone to keep your labour progressing. The waters around baby often break during established labour, but they may have already broken, and sometimes they do not break at all until baby is born. Once you are in the active first stage of labour, the midwife will want to check that you and your baby are okay in order to make sure that everything is as expected. She will offer to take your observations, such as your temperature and blood pressure, and this will indicate whether everything is going well. She will ask about your baby's movements and will listen to baby's heart rate using a handheld machine called a Doppler, or a larger fetal monitor called a CTG machine, which is used on the obstetric labour ward. For further details about the different types of monitoring, please see our topic, Fetal Heart Monitoring in Labour. The midwife will also offer to monitor your progress in labour by analysing the contractions to see how strong, long and regular they are. Progress in labour can also be monitored by vaginal internal examination. The vaginal examinations consist of an initial assessment and then repeated every 4 hours during active labour to see how soft, thin and open your cervix is. All monitoring will be offered to you with an explanation of why it is being offered, and it is your choice whether to accept it. It is important to remember to ask questions if you are unsure of anything. You can ask about the benefits and risks of any interventions offered to you, and you can ask about possible alternatives or what happens if all internal examinations are not done at all. Once your cervix is fully dilated, 10 centimetres, there can be a period of transition or change where contractions may ease off a little as baby begins to its descent into the pelvis and gets into the correct position. At this stage, you may begin to feel overwhelmed and agitated, but this tends to only last around 15 minutes or so, and your midwife will support you through this. It can be a good sign that your baby is almost here. As contractions continue, you may begin to experience an urge to push, and usually this is when the second stage of labour is commenced. Occasionally, some women will experience the urge to push before the cervix is fully dilated, and the midwife may ask you to change your position or use other approaches to reduce this urge to push.